Hey everybody, Lane here with Facet 7. I'm also here meeting with Dr. Peter Schmidt, he's a physical therapist. We're going to collaborate today. I've got some funny left hip things going on. We're going to try to figure out what's happening and offer a solution in case any of you all have the same issues. So with that being said, we started off, we've done a little summary. We've gone over some of my previous issues as childhood, talking about I was pigeon-toed growing up. We also talked about my past lifting history, where I did bodybuilding. I've also done some powerlifting. Then I got into endurance sports, and that's when this started to expose itself. From there, I'll kind of let you guide the way.
All right, very good. Yes, so definitely some pulling in the hip and groin, especially in rest. With sitting, you feel it,
Right.
and you can relieve it when you kind of pull your knee to your chest, right, and anterior
Oh
tilt
yeah.
with that.
So what we were talking about is sometimes I feel this tension in my hip, and I'll notice that if I'm sitting, I'm able to pull the knee up, and as I do an interior tilt of my pelvic girdle, kind of pushing the belly button forward, it'll pop. So
And that's always good to know. Things that
Yeah.
make pain worse, or whatever symptom you may have, make it worse, and things that relieve your symptoms, because that can kind of guide us looking where you need to go.
Right.
Now you said you've done FMS, and your FMS is good, 2s and 3s across the board, no problem with that.
Right.
I know you got shoes on with a little bit of lift, but I'd like to see you take them off, and let's look at your squat real quick. Arms overhead, just hip width apart, squat for me. Any symptoms, any problems doing that? Okay, go ahead, do it one more time. Good deal, and that looks really good. No problems right through there. Lay down on your back for me, and let's look a little bit at some basic flexibility. First things first is let's do an active straight leg raise for me. Just with this left leg first, lift it up as far as you can. Good. FMS again here, that would drop you right at about the other knee. Good. Lift your right leg up straight for me, see how that goes. Very good. Better on the right. Compare that with passive. And you've got passive, got quite a bit more range of motion than he does actively. And there's range of motion is pretty even left to right. There's a discrepancy between the active range of motion and passive range of motion. Let's look at your hip joint. Internal rotation, obviously, with your pigeon toe, no problem there. Almost excessive. But your external rotation, quite a bit limited right through there.
Yeah.
Let's compare it to the other side. Same thing here. Excessive internal rotation, but your external rotation here is normal. So definitely yes, this is a normal 40-45 degree right here of external rotation, but compare that to this side, where you can definitely feel I gotta work much harder. So the quantity and the quality is limited with external rotation. So
and I'll notice that whenever I do the pigeon stretch with yoga, when I'm on my left side doing the pigeon, it's always like I have a tighter bend at the knee. I can't extend the knee.
Compensate elsewhere to make that work.
Right.
And so we're looking for differences left to right.
Yeah.
And we're looking for differences or consistencies as far as active range of motion, passive range of motion. They should be pretty close. Well, your left hamstring is definitely significantly less actively than it is passively.
Okay.
So you've got the range, but somehow maybe not the control.
Got it.
And so an easy way to look at that is definitely some exercise we can do, working on that. Let's roll down, face down for me. Anytime you got a hip, hamstring, leg problem, you got to look at low back, you got to look at SI joint and the hip, because that triangle works together. So I'm just looking at your hip range of motion here. Just looking at his extension, good extension here on that left side, so no problems with that. Compare it here, I can feel on both sides some tension in your quads. But look at this hip extension right here. Again, the quantity and the quality much less on that right hand side. So we're getting some discrepancy here, talking about your SI joint. The left anterior chain, or your left posterior chain a little tighter, and the right anterior chain. So you got basically that your pelvis likes to do, that. Let's look at your back. Left rotation is good. Rotation pretty good there as well. Any pain problems doing that? Okay,
No.
Good. Let's come sit up again for me. This table is a little low, but what I want you to do is sit here on the edge of the table right here, grab one knee, and come lay down for me and let this other leg hang down. Okay. Sit down like that, come on, lay down on your back. Good. Pull this all the way up here. Now we're looking here at hip flexor mobility, so a little tighter in the hip flexor. Relax your knee for me, let it hang. And there you can see quads as well as your hip flexors are tight right through there. IT band, not too bad, but definitely some tension right through here. So let's compare that. Bring this knee up, hold it there for me. Good. Relax that. Here actually a little bit more pulling laterally. So this IT band a little tight. And going right through there. Alright, so a good way to kind of stretch that out is go ahead, lift your knee up for me. Bring this knee up, good. And relax it. Good. And lift it up again. And relax. Good. Lift up one more time. And relax. Let's compare it on the other side. Definitely better here, you feel the difference?
Yeah.
Lift your left knee up and relax. Lift up and relax. And one more time, lift up and relax. Good. Now lay down on your back for me again. I want to look at that hamstring. If we know you have passively the range of motion, just actively it's not quite there.
Okay.
So let's see if some contract relax cleans that up. So push down against my hand for me. Push your leg down.
What is this called? It's like PNF stretch?
It's basically a PNF stretch.
And what does that stand for? Proprioceptive?
Proprioceptive neurofacilitation.
Got it.
And
okay.
so what happens is we use contract relax. The muscle will best relax right after it's contracted.
And why is that?
It's just it's a neurologic inhibition, you know, to protect the muscle basically. So
Okay.
if we have that and we can take advantage of that, I'll let you contract your hamstring a little bit, then take opportunity when it relaxes, take up the slack and stretch into a little bit more range. Do that a few times and see if it calms down.
Okay.
So let's try that here. Keep your knee straight for me. Good. Push down into my hand. Good. Relax it. Good. And push. And relax. And push. Relax. We'll typically do about 3 to 5 reps. Push down. Relax.
That sounds good.
Push down. And relax. Good deal. Alright, let's do it again. Lift it, do an active straight leg raise on your left. And you definitely already can tell that's better because it's now past your knee if you just kind of draw this imaginary line right through there. So we can improve a little bit on that range of motion in your hamstring. We can improve a little bit on that range of motion in your hip flexors and quads on the right. That will start, you know, balancing things out. And so it definitely fits with why you're not comfortable because you're kind of shifting one direction, kind of twisting one direction. It's that muscular imbalance that we can work on right through there. Now let's see, we haven't really done anything with your hip yet. External rotation still a little bit tight, so we can mobilize your hip a little bit and see if we can improve the flexibility in external rotation.
Okay.
If the joint mobilizations don't affect it, it's more muscular, and so then we can start working with some stretching exercise to make that happen. So we'll do a little distraction here on your hip. If I do that for treatment, I probably would use a belt so I can work a little bit longer, work a little harder. But just as an assessment, I want to see mobilizing that hip, if it makes any difference in your range of motion. Also, if we can see quick changes in your range of motion, that, you know, make for better prognosis. If, you know, some of these resets don't work, and I say, hey, this is going to take a little bit longer time to recover for you. Okay, so there's some distraction, definitely better. Okay, let's do a little bit of inferior glides as well.
And so this whole time you've been kind of pulling that joint over.
I'm pulling the joint out, stretching the joint capsule in a couple different directions.
I got you.
To see if cleaning up that joint mobility affects how much actual hip range of motion you have. And roll over face down for me. Now scoot over a little bit to your right.
To my right?
Yep, there you go. Bend his knee up like this. Just leave it right there. Now kind of stretch this out a bit.
Oh, that's awesome. That's funny. I feel like I need that stretch.
Yes.
Okay. You can feel that in the joint.
So stretching basically the anterior and the lateral capsule right through here. A lot of people with, you know, restricted hip mobility like that can lead to impingement problems and laboring problems, especially if you start loading it with a lot of weight.
Oh, that makes
Or
sense.
you load it with repeated, you know, running, cycling. Think about cycling. You're constantly flexed in your hip and you're pounding a lot of revolutions. So it doesn't have to be a lot of force, but the repeated force. Definitely do that. All right, roll back on your back for me.
The others didn't really feel like much, but that one felt like a stretch. That's crazy.
There you go. And now look at your external rotation. So it's there. We can get your external rotation to clean up.
Excellent. That's cool.
After that, what we do is do some resistive exercises, you know, to kind of make sure that you own that range of motion. So you're going to load it right after you stretch it, so your brain can get used to, hey, I can go through this range of motion. I can put a little bit of weight on it. So it can be as simple as doing some goblet squatting, doing some slow eccentric deadlifts. I like hip three-way, so hook you up with some form of resistance. Work the hip both directions.
Okay.
Engaging your core as well as engaging your glutes, make all the muscles work together.
I follow. Okay.
So definitely something we can get that can get better.
Okay.
And then it's a matter of, hey, can we do some stretches that you can do yourself as well? A great stretch for this hamstring, you get a strap.
Yeah, we got a bunch right here. That was
How you
awesome.
feeling?
What a difference. I already feel looser in my left hip.
You can see the difference.
Yeah, the other two I was like, all right, but that last one when I went down and I did a triangle, immediately that was like, oh, okay, yeah, something's up. I can feel it. So
Lay down on your back for me.
on my back.
On your back, face up. So you've got some inconsistencies in range of motion. When you have active range of motion restricted, passive range of motion restricted, you think, well, hey, there's a joint restriction going on. When you have active, not so good, but passive, pretty good, hey, it's more of a motor control issue. So we can work on motor control, specifically in this case for that hamstring. So what we're going to do is bring this leg up for me, grab it and just keep it nicely stretched out. So you get a nice sustained stretch there. And we're going to bring this leg up. Now what I want you to do is slowly lower this left leg down for me with control. So take 3-4 seconds to lift it down, and then you can quickly pick it back up. So go ahead, slowly down. So work that eccentrics. You can't do this and not engage your core, obviously. So this is a great way to kind of get that going. Slowly down. Typically take about 10 reps. Why 10? I grew up in the metric system. 7 to 11, anything in there. A couple more than just do 3, just to kind of build that motor control. And always do exercise symmetrically, even though you have restriction on one side. Work on both sides. Your brain
get asked that all the time.
Your brain can learn from the uninvolved side, and there's no reason not to stretch it. Good. Let's switch it out. So let's put that foot over here. Same thing with the right leg. Slowly lower it down. And the whole time you want to kind of keep that core engaged. You want to keep your back flat, so you don't want to create a whole lot of arch in your low back. You want to keep your core going as well. And you're doing this better than most. Obviously, if you haven't worked out in a lot, this is a struggle for some people just to work through that. But oftentimes...
And you want me to come up quickly, correct?
Go up quickly and slow down. So the concentric phase is fast, the eccentric phase is slow, and just it's a motor control exercise. So it's all about the control right there. Good. Let's do one more. What's nice with this as well, you get a sustained stretch on your left leg while you're working your right leg. So there's all kinds of different things happening. So I like exercise that do more than one thing at a time. Now go ahead, bring your foot down again for me, both flat. Let's look at your left active straight leg raise again. And now look at see where you are. You're definitely past mid-thigh. So now you're truly a 3 on this side as far as your active straight leg raise, where you started just about at the knee, and that was generous. That was definitely tight compared to the other side, right? So that's a good place to get started. I know you've been doing some banded type things on your hip. Those are continue to be good because it does help, mobilize your hip a little bit.
Gotcha.
What I would follow this up with is a little bit of hip hamstring flexibility or hip flexor stretchability.
Okay.
Do we have some padding? You're okay sitting here on the floor.
Yeah, that, or I can get.
You can actually do it right here because you can see right here. So all I want you to do is come and sit half kneeling. Let's start with your right leg up and left knee behind you. So.
Right leg up, left knee behind me.
Yeah, no, you're half kneeling on the table. Sit
literally
down.
up here.
Half kneeling. There you go. Perfect. Good, stay nice and straight up.
Okay.
Good. And now I just want you to lean forward without bringing your shoulders forward. Just lunge into it and back.
And the back foot, do you want the toe flex?
You can leave the toe flex, you can leave it neutral. A progression from this would be doing it with your foot on the bench, and you get your quad even working a little bit more as well. So this is a good place to get started right there.
Okay.
Do about 10 of those. Just quick stretch.
And should I activate my glute at all, or just focus on passively
you can activate your glute. What I don't want you to do is bring your shoulders forward. I want you to bring your whole body forward, so you're focusing on bringing that pelvis forward and your body staying nice and straight up. And this is your good side. So it's good to start with your good side, let your brain kind of, hey, this is safe, I can do this. And then we'll do it with your other side where you'll see you'll have a little bit more tension.
Okay.
Good, so let's switch for me.
That's interesting. So it's the front right is tight and the back left is
That's tight. And that's creating that torque through your pelvis.
You think it's coming from the shoulders?
Well, the shoulders is definitely part of that. And so.
Oh, it's funny. I can feel this hamstring.
That hamstring's firing. It's like, hey, what are you doing?
Hey.
There you go. Good. Keep that core engaged. Stay nice and straight up. Good. There you go. Now we talked about owning that range of motion, so stay nice and straight up. What I want you to do now is go to a point of stretch, stay there, and then do an upside down kettlebell press.
Okay.
Now we're getting a lot of engagement right here.
So I'm going to do that on
with your right arm. Right arm.
Gotcha.
So own that range of motion.
Okay.
Go to that stretch, and now just do press up. There you go, and back down. Stay in that position, just do a couple presses for me. I want you to own that movement.
I feel like I was able to go farther just now.
Yeah, lean into it. So we bring the core in, we bring that right shoulder in.
Whoa, you saw I was able to go even farther.
There you go, get some more range in there. Owning that range. The hardest thing is you're going to get stretched, it's going to go back to where it came from. But if you strengthen after you've done your mobility work, you're going to not go backwards as far, and you're going to actually make progress.
How many more?
One more, good measure, because you're doing it, not me. Good, all right, come on off. Same thing I would do, we've got to own your hamstring a little bit.
Okay.
So we can do that with a kettlebell, just do a simple.
I can feel it.
Let's do just a simple kettlebell deadlift.
Okay.
Focus on that eccentric again. Bring your hip back.
Okay.
Bend your knees a little bit if you have to. Try to place it between your knees.
Okay. And you want me to focus on the stretch and the hamstring?
I want you to focus on the stretch and the hamstring. So it's all about the eccentrics, owning that movement.
Okay, understood.
There you go. There you go. Keep your back straight, your head in line, perfect. And back down. Good, slow on the way down. Slow, slow, slow. Own that movement. And this is how you will groove that movement in your brain and say, hey, I can do this. I can handle this. Good. So we do some passive movement, we do some active movement, and we do some loaded movement. And that's a great way to progress this.
I follow you.
And you see your toes gripping.
Okay.
See a little, yeah, that's fine. You see it's challenging, so that's good. It's very different without shoes.
Yeah, they taught us to, I did the strong first,
Yeah.
and they said grab the ground. So.
Grab the ground. What's a great way to kind of work in your hamstrings some more there too, is do that, but now toes up.
Oh.
And so now you're really going to get a nice stretch. You might not be able to go all the way down. Hey, how you doing? Let's see if that's okay without your shoes. You definitely don't want to be in lifters doing kettlebell deadlifts.
Yeah, I can feel that. That works.
That works. Research has shown that eccentrics may be even better than stretching on gaining tissue extensibility. Especially when you got a motor control issue and not a real, scarred down tight muscle that's had trauma or something to it. There you go. Last one. Good. So that way you have something you can stretch yourself. You work on that hip flexor a little bit yourself, right? Work on the hamstring a little bit yourself, just to kind of keep that mobility going. The prone press ups will be a good way to kind of make sure you keep good tissue extensibility in your lumbar spine as well.
Yeah, that was cool.
Yeah?
I felt that a lot.
All right, good deal.
So that was a really cool experience. I've learned a lot about what's going on with my left hip, how my body is moving. And then the question is, well, what's next? Where do you go from here? What would you say, Doc?
Well, I say in your case right now, I would start with these 2 home exercises, do them a couple times a day at home, and monitor how your symptoms have been. Do that for about a week and see if there's any change in your symptoms. Better, same, or worse will tell us a little bit of what's going on. Then if you're a whole lot better, obviously there's your answer. Just keep doing that and slowly progress your workouts.
Right.
If it's not getting any better, then it may be time to get in a couple more hands-on sessions, because you definitely got relief with some of the passive treatment, and then we can expand on some more exercise that you can do as well. But I would definitely start with just, hey, make some slight modifications, see how those work, and give it a little bit of time to see how that works, and then go from there. You don't need to come right away.
And what I love about that is I'm hearing it's more of a conversation. It's more about on each week or each day, we're learning about how I'm showing up and utilizing the resources I have at the time. I think what happens with a lot of people is when they're looking at a physical therapist as far as education or a physical therapist as far as rehab, but how does that apply into the day-to-day mover? And so this is a really cool opportunity. We're getting to partner with him on, because I'm a day-to-day mover. I'm constantly on top of not only mobilizing myself, but my training. I follow programs, and I try to keep myself in the best shape as possible. With 10 years of training myself and 10 years of training clients, as well as practicing all these different sports, I still find these walls that I run into, like what's going on with my left hip. You can only look in the mirror and diagnose yourself so much. So having a professional be able to talk to, tell me what's going on with my hip, and realizing that it's not like I'm gonna have to go through 12 weeks of rehab to get back where I want to go. Within a couple minutes, he was able to show me some mobilization techniques and give me some insights on how we can start training in the right direction, to where even though this wasn't a limiting pain, it still shows up for me every day. It kind of nags at me, hey, I'm here. So that plays into my performance every day, and it also plays into just driving home from work. I can feel this little tightness, So knowing that I can have access to meet somebody, and it doesn't have to be some 12-week remedy, as much as, hey, let me talk to you about this. Here's a quick conversation. Now I can go about my day and implement some new techniques, and then maybe next week or the week after, I assess where I'm at and have that conversation again. It's such a valuable tool to be able to work with physical therapists in this realm. And when we talked the other day, you had mentioned how there's this turf war going on between trainers and physical therapists. Can you elaborate on that?
Yeah, I see, some therapists are afraid that trainers step outside what they need to do and treat people in pain and give them advice where they're not really sure what the pathology is. And there's a lot of trainers that say, well, there's a lot of therapists that don't know how to, properly exercise, program and make things going. And so I think a lot of it is not knowing exactly, what each other, what each profession knows or doesn't know. And so I think, I want to break down those barriers.
Right.
Because trainers definitely have, a lot of knowledge. Physical therapists obviously have a lot of knowledge, and together, two know more than one. And I think that's really important. That's why I like the FMS, because it's kind of a nice, breakover. It's like, hey, we can talk the same lingo here a little bit, because that's definitely important.
Sure.
When you have pathology, it's important to know, these things that physical therapists have learned in school, because you got to look beyond to just where the symptoms is. It may come from something very different, and you need to know differential diagnosis, because this could have also been something very, very bad. And so on the other hand, trainers are great at doing some exercise. So they'll say, you have some pain, see if with coaching you can improve upon it. See if your exercise program can change it. If that pain or nagging continues, you need something more, and that's when the physical therapist can step in. And then when the physical therapist is done again, hand them back over to the trainer so they can, progress the routine. It's all about communication. And I think lack of communication, means for, these turf wars, the more we know about each other, the more we can bridge that gap. Yeah, I think that's what the patient, the consumer, benefits.
Absolutely.
So working
being
together.
Able to integrate
absolutely. So
information.
Places like this, we could have physical therapy and trainers in one location, one-stop shop. That's ideal if I'm a customer. If I'm having some pain, what do I do now?
Well, I think that's part of the other breakdown is, I'm going to the gym, say I've got a personal trainer, I'm going to a class where I see the same coach every day. And, if I start having an issue and they are not able to help me through that problem, and then I've got to go to a doctor to get a prescription to go to a physical therapist who has no idea what my day-to-day is. And then even further, the issue being is that when I do get to this physical therapist, I'm just a number. They got 3-4 clients at a time. And so I'm dealing with an assistant that's going based on what the paperwork said that has nothing to do with what my coach is seeing me do. And so there becomes this disconnect, and I may go for 12 sessions and still not fix the problem. Here, having somebody who says, hey, what are you doing? I'm right here, I can knock on the coach's door. Hey, what's this athlete performing like? What's happening with their movement? Is there valgus when they jump, the knees, you know? So it's like having access to where both instructors can communicate about what's best for the person.
Absolutely.
You
Yeah.
can't beat
And oftentimes you go to the doctor and say, okay, well, it's hurting with exercise, stop exercise, take some anti-inflammatories, take some,
yeah.
and you waste
Or
2-3
the cortisone
weeks.
shot.
Yeah,
The all
there you go.
infamous cortisone shot. We'll just inject you and make it go away for a little while.
So, you know, and you waste that time. Well, you just kind of, with some slight modification to your therapy and to your exercise routine, you may be able to continue going. And the best thing is to keep moving. Now, maybe different movement, less movement, variability, but keep going.
Right.
The last thing you want to do is do nothing.
Right.
And so, for a lot of simple things, they can recover quickly. If you let it drag on for a long time, it becomes a chronic issue. Your body's now kind of used to this, expecting that pain, and it becomes a lot more difficult to change. So the quicker we can get there, the better it is. So,
Well, I'll tell you what, I'm really looking forward to collaboration, and I'm looking forward to sharing this knowledge and this option, this opportunity with everybody else that's affiliated with our facility.
all right,
So
perfect.
thanks. Cheers. Appreciate it. Yeah.
All right.